Hello guys, this is me Dr. JK, and today we will discuss about squamous odontogenic tumors. We have studied about the ameloblastoma and calcifying epithelial odontogenic tumors in our previous lectures, and today we will discuss about squamous odontogenic tumor. Okay, it is a rare benign odontogenic neoplasm. Fewer than 50 examples have been reported up to the date. They are mostly present inside the bone, although a few peripheral examples have been described. Peripheral mean it will be present in the soft tissues, and it may arise from the neoplastic transformation of dental laminar rests or perhaps the epithelial rest of malacis. Originate within the periodontal ligament that is associated with the lateral root surface of an erupted tooth. Okay, not unerupted, it is erupted tooth. Unerupted was with that of the ameloblastoma and the calcifying epithelial odontogenic tumor. Here we have erupted tooth. Okay, now we'll discuss about clinical features. It is most commonly present in the patients who are 8 to 75 years of age. Average age will be 38. So it covers wide range of age. The alveolar process of the maxilla and mandible will be most common places where these tumors can be found. Okay, and there is no site predilection, and also there is no sex predilection if we talk about squamous odontogenic tumors. A painless or mildly painful gingival swelling will be there, and often associated with mobility of the associated teeth is the most common complaint, because it will lead to the resorption of bone, and that may lead to the movement or mobility of the associated tooth. About 25% of the reported patients have had no symptoms, and their lesions were detected during a radiographic examination. Okay, mostly it will be a painless or mildly painful gingival swelling, and in some cases, that is 25% cases, there will be no symptoms and lesions will be detected on the routine radiographic examination that is done for another purposes. Okay, if you talk about radiographic features, they are not specific or diagnostic, okay, and consist of a triangular radiolucent defect lateral to the root or roots of the teeth, as shown here. Here you can see the lateral incisor. This is the premolar. You can see radiolucent area here, but remember, this is not diagnostic or specific to the squamous odontogenic tumors. Okay. So there will be vertical periodontal bone loss. Okay, here we can see that is why there will be the mobility of here we have the mobility of the tooth or teeth, because there is vertical periodontal bone loss. The radiolucent area may be somewhat ill-defined or may show a well-defined sclerotic margin, and mostly they are relatively small lesions that seldom exceed 1.5 centimeter in greatest diameter. Here we have radiolucent area here. Okay, and this is lateral to the lateral incisor and the premolar, second premolar. Okay, second premolar here and lateral incisor here. This is the radiolucent area. Okay, now we'll discuss about histopathological features. A distinctive and consist of a varying shaped island of blind appearing squamous epithelium in a mature fibrous connective tissue stroma. The peripheral cells of the epithelial island do not show the characteristic polarization seen in ameloblastoma. In ameloblastoma there were characteristic polarization, but here there will be no characteristic polarization that was seen in ameloblastomas. Microcystic vacuolization and individual cell keratinization within the epithelial island are common features. Laminated calcified bodies and globular eosinophilic structures which do not stain formaldehyde are present within the epithelium in some cases. If you talk about the stain of formaldehyde that were present in our previous lecture, we studied about that were present in the calcifying epithelial odontogenic tumor or Pindberg tumor, but here there will be no stain formaldehyde. Okay, island of epithelium that closely resemble those of the squamous odontogenic tumors have been observed within the fibrous wall of dentigerous and radicular cysts. These have been designated as squamous odontogenic tumor like proliferations in odontogenic cysts. Okay, this point is again very important. Okay, you should memorize this point. the island of epithelium that closely resemble those of the squamous odontogenic tumor have been observed within the fibrous wall of dentigerous and radicular cysts. But remember, these islands do not appear to have any significance relative to the behavior of the cyst. Okay, there will be no significance of these things as far as the behavior of the cyst is concerned. Okay, now we'll discuss about the treatment and prognosis. Conservative local excision on curettage appears to be effective for patients with squamous odontogenic tumors, and most reported cases have not recurred after local excision. So it means excision is the treatment of choice for the squamous odontogenic tumors, and it means the prognosis is good. Maxillary squamous odontogenic tumors may be somewhat more aggressive than the mandibular lesions, with a greater tendency to invade adjacent structures. That is because of porous, spongy nature of the maxillary bone. So if we talk about the treatment and prognosis of the squamous odontogenic tumors, then it will be conservative local excision and or curettage, and the prognosis is good for squamous odontogenic tumors. So that's it. These are the references of this lecture. Hopefully you enjoyed my lecture. If you enjoy my lecture, please subscribe to my channel and click the bell icons for notifications and new videos. So till my next video, take care and bye bye.